wanted to be a nurse from being a very little girl, always playing with my dolls. They were always poorly, making them better, bandage them, and my mum would say to everybody, when I left school at 15, Elaine will do nothing other than a nurse. That's all she's wanted to be from as long as we can remember. So from being a little girl right up to 15, leaving school, I still wanted to be a nurse, and 4 days later I was stood here, 15 years of age and 4 days outside matron's office here, registering as a cadet nurse and as proud as punch.
I always said, I'm going to be a doctor, but you know, life happens. And when I got to the age where I had to go to the university, medical school was very expensive back home, so my parents couldn't afford it. So I went to normal university instead, and I studied philosophy. But then, when I came into England about almost 20 years ago, I started working in nursing homes, residential homes, supporting elderly patients and all that. It's been my passion, you know, so I had the opportunity to study nursing when I was on M2 acute medical ward.
Oh, right.
So the opportunity came up to do the apprenticeship nursing pathway, and I applied for it and I got it. So I was very happy over the moon. Like you said, one of my favorite moments is when I was a support worker on the acute medical ward, and I witnessed an admission. A gentleman was admitted. He was returned for about probably close to 2 months because he was acutely unwell, and we looked after him. Me especially, he really liked me. We got along really well, and
how nice is that? When
exactly,
you know that they really, you know that they really like you. That's brilliant.
Yeah, and the day he was leaving, I did all the discharge documentations and booked his ride home, and the ambulance crew came to pick him up. So they came in with the wheelchair into the ward, and my patient was waiting, ready, all packed up. And one of the ambulance paramedics said, "Okay, gentlemen, get on the chair and let's wheel you down. You're going home." And he said, "No, I'm going to walk out of this place." That made me cry because he actually walked out. He was around 92 or 93 years old, man. He walked out. He didn't sit on the wheelchair, and that made me so happy. I was so
You had been on that journey with him
from the start,
from the very beginning. Those number of weeks he was with you, the ups and downs, and you know, all the difficult times. But as I've just said, on that journey, and then come to the end, and for you to see him go out, and then the true caring thing, he was here. You cried. You were emotional. My day, the wards were all the Nightingale Wars. They're all the 30-bedded wards. So you went in and you had the whole 30 patients in front of you, 30 beds, and you were responsible for the whole package of care from them, from basic observations to dressings to theatre journeys, all of that sort of thing. Today, my comparison today is that most of the wards, as far as I see when I go around, they're all in bays or pods, whatever you call them, and the nursing team have got those 6 or 8 beds in that pod. So your responsibilities today are focus on that bay you're in, those 8 patients, the whole care package for those 8 patients for the day. So the other 22 or 3 or 4 patients in the ward, you've no involvement with because you're not looking after them that day. The difference to me was we looked after the whole lot. That was one thing.
Well, we use technologies a lot now. Like in those days, they don't use a scanner to look for vein. Now they use a scanner to look for vein when they want to take blood or do a cannula or things like that. So over the years, technology is advanced.